Okay, so the idea is to talk about the HV interval, which is the interval between the his and the ventricles. Now, maybe let's look at the big picture. We're talking about, let's talk about the PR interval in the ECG. It includes the AH interval, which is the interval between the atrial depolarization and the his depolarization, plus the his to the ventricle depolarization interval. Those two intervals build your PR interval. Now, the HV interval should be under 55 milliseconds. If it's prolonged, it's said that there is an infranodal pathology. Infranodal because it's after the his, the bundle of his, or from the bundle of his, or after the AV node. This is more correct. It's from the his to the ventricles. And when there is a delay, when it is prolonged, and prolonged, we are talking about three categories. One is between 55 to 69. This is, let's call it mild. Moderate is between 70 to 100, and severe is more than 100. It tells us the risk, for example, for becoming from just a pathology of prolonged interval of electrical activity propagation to to block. Now, when this his ventricle HV interval is more than 100 milliseconds, for example, there is a high risk. This is a red flag, and there is a high risk for sudden infranodal block. For example, Mobitz 2 or complete AV block, high grade block between them, something like this. So HV interval in electrophysiological study that usually we measure that there because you cannot really conclude it from what you see on the PR interval because the PR interval is a combination of both. So you don't really know what really is prolonged or how much each one is prolonged. But in electrophysiological study, you can measure the HV interval and make an assessment of what is the risk of your patient to uh, just make a block. So if it's symptomatics or if the HV interval is very, very prolonged, more than 100 milliseconds, it tells you that there is more justification for a permanent pacemaker installation. Now, what can cause this HV interval prolongation? As you can see in this image, there is something that is iatrogenic because there is a, let's call it artificial mitral valve after a TAVR, and you see the aortic valve. Sorry, this is the aortic valve. This is left. And after this replacement, there is a damage to the area near the septum, where is the his and bundle branches are, and there is a damage. So we see that iatrogenic can cause it. Also, not just iatrogenic, but also, for example, anything that can cause fibrosis like sarcoidosis and things like this. Myocarditis can also cause it. Trauma, as you saw right over here, and everything that can cause damage to this area. Okay. You also see that it can manifest in the ECG. It's not 100%, but it can present with RBBB or some block, which tell you that the bundles are, let's say, poor or diseased. So understand that something is not right over here. And in electrophysiological study, you can measure the HV interval and understand how much this, let's say, diseased this bundle of his and bundle branches. So this was, in some words, very basic understanding of a HV interval, which tells you about the health of the his and bundle branches until the ventricles, namely infranodal for infranodal blocks, and the risk for the patient to just develop a block. Now, you need to understand when there is a more than 100 milliseconds for HV interval, there is a very high risk that the patient just suddenly do a block high degree, namely Mobitz 2 or complete block, just suddenly. So this is the high risk of those patients with very prolonged HV interval. So this was some words about the HV intervals. Thank you very much. I won't talk too much and any more about it. Of course, this is not everything. If there are any mistakes or correction, please tell me. And for now, and that's it. You can see that here in the image, they show you that the PR interval is prolonged when the HV is prolonged, but you can't, I think that you can't really count on it because there is also the AH interval and you don't really know what is prolonged and how much is prolonged. So I'm not sure that it's so reliable to just make your decision of the HV interval based on the PR interval. That's it about the HV interval. Thank you very much. And that's it.